Good afternoon, everybody. Today is June 17th, 2022. My name is Scott McGann with the Falmouth Health Department. We're doing our weekly COVID-19 update. Our email is health@falmouthma.gov. Our phone number is 508-495-7485. So before I get started, I just want to make mention that tomorrow is Falmouth's Household Hazardous Waste Collection. So from 9 to 1, Falmouth High School for oil-based paints, different paints, pesticides, gasoline, hazardous materials. You can visit barnstable.county.org, the health department, and go to the Cape Cod Extension. Our website's also as well what you can bring. A little tip: a lot of people like to be the early birds, so there's usually a line at 9 a.m. and it's usually pretty thinned out by 11 a.m. So come on the second half of that, you would have much less of a wait historically than what was there, right at 9. So the people that wait usually the longest at these are the ones that come early, thinking they're going to be early. Everybody sort of does the same thing. But anyway, we have our collection tomorrow, 9 to 1 at the high school. Just want to let you know. So case count-wise, we are at 8,044, which is 38 cases for the week, 6 probable cases, so it's a better trend than what we've had. Again, these are all just confirmed. These do not include home tests. The probables are not the home tests. They are probables taken at like a convenient MD or a CVS or something of that nature. Our incidence rate dropped to 24.5 from 34.6, and our positivity dropped from 9.73 to 7.15, so we've had a better week. You can see that here in the chart. The far right is our most recent one. And so we went out, 1, 2, 3, 4, 5, and then peaked at week 6, 1, 2, 3, 4, 5, and started to drop down. So it's sort of that cyclical cycles that we seem to get with this. And again, these are just case counts based on PCR. These blue dots are all PCR cases. They do not take the home kits, which could be a multiplier of anywhere from 2 to 5 times more actual cases than we do get. So that's where we are with that. We have curve. This is our flattening the curve. So based on PCR, we're starting to, having lower case counts. They're not, the big spike that we had where their CCO were going up really fast vertically and separated out the dots. Those are really bad times. And the flatter and the more densely packed the dots are, the better we are. So that's where we are with that. As far as where CDC guidance on community transmission levels, we went to the low category. I said that last week's that we were pretty close to going that way. We jumped from high to medium last week, but our COVID admissions per 100,000 was just over 10. And since we've gone under 10 and our case rate is under 200 and our percent of staffed inpatient beds occupied by COVID-19 is always been well less than 10, that we drop into the green. So these are adjusted per 100,000, so anything we're at 142. So 9.8 and 2.8, we are now in the low category, as is much of the state. Hopefully we stay like that at least through the summer and early fall. So as far as looking at hospitalizations, you can see that we had the peak obviously in January, a big peak in January of 2022, just the sheer number of cases with the original Omicron. Drop down, start to peak up a little bit like we saw this last 6 weeks, and now it's starting to work on its downward trend. And there's an ebb and flow to these, and that's sort of what it's showing right now. As far as case counts go, I think it was 19-something last week, and we're at 1,600 for a 7-day for a daily case count from last Thursday to this past Thursday. I take this is yesterday's data, and so that's good. Our positivity, everything for the state is on a downward trend, which again is good. You can see the trends there are all downward with a bit of a peak that we've just had with the more recent variants of Omicron. As far as MWRA, it's a little hard to read. I'm going to jump to the south and north. So this starts the beginning of the year with Omicron way up here with the recording of the amount of viral RNA from COVID. And you see where it dropped in March and then started to come back up over that last, couple months. Peaking, it looks like right around mid-May. And it's sort of a downward to flattening trend. I wouldn't say it's gone down, but you can see the last couple of weeks it's up, down, up, down, up, down, sort of baseline flat, more on the flat side, not going down as sharply as it was. But that's kind of where MWRA's numbers are. which measures wastewater levels, and so it's a good indicator of what what COVID is doing in that sewer system that takes care of the Metro Boston area. As far as our incidence rate, 24.5, so somewhere in the middle range to basically right around what the state's average was for incidents. And maybe, there's about 5 or so towns higher, 5 or so, it's 8 towns lower, somewhere around there. So sort of in the middle as far as our incidence rate with our peers here on the Cape. Our same thing with our percent positivity. There's plenty of towns that are higher, some towns that are lower, so sort of mid-range for that as well. And that seems to be trending downward, as it usually does as the weather gets better. Generally the warmer months, lower amounts of cases. That's been the way it's been the last couple summers anyway. As far as this chart's pretty stagnant. This is the number of breakthrough cases. So of all the breakthrough cases, if somebody has been vaccinated and gets COVID, it's considered a breakthrough case. 1.61% of all breakthrough cases resulted in hospitalizations, and the death rate of 0.5% among breakthrough cases among those that have been vaccinated. So those numbers have been pretty stable. As far as booster doses, again, anyone over 50 can get a second booster at least 4 months after their first. And then whether you're between under 12 and older or 18 and older, based on the different medical conditions, you can do it the same thing. Visit mass.gov for the lists of those. So the more severe ones, you can go as early as 12, and some comorbidities, you have 18. So it depends on the medical conditions, and anyone over 50. And you can mix and match. The news for booster, and I put it on the booster, but I should have said just vaccine news in general. The FDA Advisory Board voted Wednesday to recommend authorizing Moderna and Pfizer for vaccines for 6 months plus. So it'll be 6 to 4, 6 to 5, right in there, depends on which one. And so more to come on that. So you may see that opening up. Those probably come through your pediatrician. Pediatrician's office are much more geared for vaccines because that's one of their primary functions, and so that's probably where that's going to reside, would be with the pediatrician's office. I just don't have any details. I just read that happened this week. Vaccine Finder, again, vaxfinder.mass.gov. Again, plenty of open spots. We check it every week. I think it was 150 open spots over the next few days. Homebound people, again, if you've gotten into town, you notice a neighbor hasn't really left the house and hasn't really gotten vaccinated, you talk to your neighbor that you hadn't seen in a while, they can call, or you can call the health department. We can reach out with the VNA for anybody who's homebound that's looking for any type of first, second, or any of their boosters. For the rest of us, again, pharmacies, convenient MD, you go on VaxFinder, there's plenty of open slots for vaccine. Testing, mainly home kits is what most people are using. The hospital still is open as far as I know, and convenient MD, the pharmacies are still doing testing. And some businesses like healthcare entities and so forth to do it as well. As far as vaccinations, made a little bit of gains. Last week was 85. This week is 84 doses, but they're very small, only 44 people. So 44 people got boosted, 22 people got their second dose, and 18 people decided to get vaccinated for the first time. So those numbers are, sort of low, but I think anybody who's wanted, it's had, like I said, plenty of opportunity, and these numbers are just going to be small gains from now on out, unless we open it to a category. So you might not start seeing a jump now that once it does go and gives you a different category, you'll see these numbers jump, and it'll be jumping in the first dose, and then, 21 whatever days would be later would be the jump over here in second doses, and that's because we're going to open it up to another category. Right now it's 5 and older. So this numbers for those that are over 5 will probably be pretty stagnant, and then you'll see a jump once it's approved for the younger age group. What are we talking about for variants? The original Omicron's pretty much gone. The BA2 is fading away. The BA 2.12 is your primary one right now. It's accounting for about 77%. And that's going to work its way being eliminated by the BA4, and this is cyclical. So as the purple goes away, taken over by the pink, which is taken over by the red, which is taken over by the light green, then gets taken over by the dark green. So it's sort of this ebb and flow with the different variants. And so this comes from the CDC. This is the variant proportions. As a recap, our cases are down, which is good. The entire county, and most of the state, if not all the state, is now considered low. There's plenty of vaccine. There's plenty of tests, there's plenty of home tests, plenty of booster shots. There's pending vaccine approval for those under 5. There are currently no mandates. The only advisory technically is the Board of Selectmen and town-owned buildings do advise that you wear masks, but other than that, there's no talk or anything of any future mandates. And, talk to me in the fall if something happens, but hopefully we stay the course. And so that's what I have for an update this week, and see everybody at the next one. Thanks.